Beka Bohannon is a licensed mental health therapist who went to work for Hamilton County government 4 years ago. Since then, she has helped to shape the county's response to the opioid crisis and leading its recovery courts. Now, Beka is days into her new job as administrator for the county's Health and Social Services Division under Hamilton County Mayor Weston Wamp. I spoke with Beka and Joeli Poole, Public Information Officer for the Hamilton County Health Department. Beka, Joeli, thanks for joining us.
Thank you for having us.
Beka, tell us more about your new role.
Well, I'm learning it as I go. I'm about 3 days in at this point. But ultimately, it's going to be to lead health and social services for Hamilton County government. So that includes our health department and our ancillary services as well.
And talk more about your background with the county, with public health, with public service.
So for around the last 20 years, I've been working with humans at every intercept point of human growth and development. So from infants all the way to seniors. What I found is that sort of my bread and butter for the last 15 years has been primarily serving adult women in behavioral health and addiction services. I'm a licensed therapist through Tennessee Department of Health, so I worked in that for years for a company called The Next Door Recovery primarily. We provided addiction and behavioral health care services on every level of treatment, from medical detox to outpatient. And ultimately, as a director for that company for 13, 14 years, I had employees in 3 cities, so traveled a lot, but that's a great nonprofit and did great work for a long time.
How were you drawn to that work?
You know, I think it goes back to my bachelor's degree, which is in psychology and sociology. I always wondered why people do what we do. And I'm still curious about that, frankly. I took this road of trying to understand human behavior and then ended up getting my master's in clinical mental health from UTC. So I've been in the Chattanooga area for quite a long time. And it still is something that just makes me curious. And I think we really thrive as humans when we're remaining curious.
And how did that bring you to public service and Hamilton County government before this position?
So I joined Hamilton County government in 2021. I was appointed by former Mayor Coppinger as the director of mental health court. Spent around 2 years as the director of that court. Was able to form great relationships with all of the members of our judiciary. I can't speak highly enough for the judges in our county. They do amazing work. And then as well as all the staff of the court. So I shifted from director of mental health court to director of intergovernmental affairs, where I continued to oversee the mental health court, the newly formed Veterans Court, as well as all of our opioid abatement efforts while I was in that role. And then to most recently, super grateful to be appointed by Mayor Wamp, and supported that appointment by former Commissioner of the Department of Health, Tennessee Department of Health, Dr. Alvarado, and then of course acknowledged by Hamilton County Commission last Wednesday.
What are some things that you learned from your work on opioid abatement?
Really, that is when I started to have the most intersection with our current health services at Hamilton County. The opioid epidemic touches everybody and impacts families tremendously still to this day. And so the work that I did on that is we were looking really at not just how do we provide treatment to people, but that's when my real journey started of how do we get to the roots of addiction, primarily at its inception point earlier in life. So are there things that we can do to educate people and parents with children? People have heard me talk a lot about screen times and its impact on brain development. And then as we age, what that's implications are. Of course, vaping continues to be very pervasive in youth, which also can lead to further addictions. And so the opioid abatement work, we had to partner with EMS, the health department. At Intergovernmental, we worked all of our courts as well with opioid abatement efforts. And so that is and continues to be a true public health crisis. And I really learned at that moment that when we all collaborate, we can start to massively move the needle. We have seen great reduction in opioid-related deaths. We've still got a lot of work to do, I'll say that. But to move that kind of needle into improvement, to me, it just solidified when this position became available. I knew then it's what I wanted. Because if we can collaborate and move the needle on that one piece, what else can we do for all of community health when we continue to collaborate? So that's the spirit that I'm bringing to this position, is one of innovation, collaboration. That has been how I found success within the county, is collaborating with partners. So we want to do that. We want to continue to foster great relationships in the community and really look at propelling community health forward in innovative and creative ways.
Talk more about the mission that you have been tasked with by Mayor Wamp for this position, and some initial thoughts, initial ideas about how you're going to tackle that.
I'm fortunate that the mayor and I really are aligned in our vision for the future of health services. Aside from embarking on the early stages of the design and implementation of a new facility, with change comes amazing opportunity. And we are at really the crux of massive opportunity for all things health and social services. And to be honest, I've been incredibly humbled by just walking the many floors of the current building on 3rd Street and meeting staff. There's programs that we do that are amazing programs that I didn't know about. And so really what Joeli and I want to do is work on our branding, really getting that out to the community of making sure we all are aware of the great programs that we do. But as far as future vision goes, we really want to make sure that the existing amazing programs and staff that we have, that's out there, that people know. A passion point for me is that health services is more than just birth certificates and immunizations. We really want to be the beacon of health for Hamilton County. We want to be the partner that you look to for all things health and social services for that matter. So really putting forward our great programs, modernizing public health is what we're wanting to do and what that delivery looks like, all while continuing to provide person-centered care and services. That is at the heart of what we do and a large part of my mission moving forward.
In making changes, how do you plan to meet people where they are, to communicate and to hear feedback about changes? Because people see the headlines, this is before you coming on board, but people see the headlines about the Soddy Daisy Clinic or selling property here or there, and there might be all of these justifications for them, but people always feel the need to be met where they are and to be communicated with and to be treated like adults.
I was speaking with some staff yesterday, some leadership, and I was telling them all, you can't turn a cruise ship, super quickly. And so effectively what we're trying to do in modernizing our delivery of service is gently shift a massively moving cruise ship. And that takes a lot of time, and it takes a lot of collaboration and a lot of coordination. And anybody who's been around me for a matter of minutes knows that I move quick. And so we're going to meet with whoever we need to meet with. We're going to get feedback from whoever we need to get feedback from. And I also know that not every decision we make is going to be a win for every single person, but we're going to try and do our best to meet every citizen where they're at, to provide the best care that we can. Again, all while continuing to modernize that effort. So we're going to do our best, but I don't shy away from feedback, even if it's something that I don't want to hear. But there's a lot of great work that we're doing, and I'm excited to capitalize on that momentum and continue to propel us forward into the new future.
We talked about opioids earlier. What are other public health challenges that you see from your experience that are of particular concern, particular priority?
I think there's quite a few. I think when we talk about opioids, and one of the things that I've kind of mentioned a few minutes ago, is if we start to look at addiction in adulthood and we walk it back and how it relates to childhood growth and development, we can start to see some public health issues that we can address now. Nutrition, education about nutrition, things like that I think are important. I've said it once, I'll say it again, screen times, and then again vaping. And when we look at continued whatever substance use of any substance, whether it's opioids, synthetics, items you can get from a gas station, I think we have to look at, with human growth and development, when we become uncomfortable, even as children, how do we mitigate that uncomfortable nature? What do we do to either self-soothe or talk through how we're feeling? As a licensed clinician, obviously, those are points that I find most important. But addiction, I think, is a big one that we have to look at. And again, nutrition is key to so many things. Early human growth and development, I think, is primarily important. And we have a lot of great programs around that. But moreover, I'm excited to continue to learn what it is that we're doing now. Then we can find any gaps that we have and start to fill those as we move forward.
You talked about collaboration earlier. How do you envision collaborating with public health officials at the city of Chattanooga, all the way from the state level? And since we're in Southeast Tennessee, we're bordering another state.
Collaboration has been my bread and butter. You can have all the energy in the world, you can move as quick as you want, but you're just one person. And so it is of high priority to me to continue to foster the existing relationships that I have now, continue to build new ones. And I think you bring up a good point of our border states and how are we partnering with them. Going through a massive public health crisis, if it has implications for our border states, we have to have existing relationships that we can make a call. We know who to contact and we're not scrambling on the back end. So building those relationships, learning from our partners is a huge priority for me in the coming months. touring some of the other urban areas of Tennessee and also North Georgia, their health services. I know Knox County has a very robust and phenomenal group that they're running over there, so I would love to see that. But I'm bringing forward the relationships that I have and continuing to build new ones. I think that is going to be the true key of improving public health for our area.
And Joeli, there's an open house coming up.
Absolutely. So that health department is hosting their second annual back to school open house event Thursday, July 24th. That'll be at our East 3rd location right there next to Erlanger. It's from 4 to 7 p.m. We're offering free backpacks filled with school supplies, free food from local food trucks, free snow cones, free childhood vaccine records. We're also offering those school-required vaccines. You can get those while you're there, and as well as meet our team, meet all the programs that are family-focused and child-focused, and we want to see those families thrive in Hamilton County. So this is a great opportunity. It's a one-stop shop at Hamilton County Health Department. Come and meet us, tour the facility, get to know our programs, and have some fun at the same time.
And for people who want more information, where can they go online?
They can visit our website at health.hamiltontn.org, or they can just give us a phone call at 423-209-8000.
All right, Beka, Joeli, thanks so much.
Thank you.